sometimes they have urgency, incontinence, and you try everything. It doesn't work. What do you do next?
Very interesting. There is a treatment which is called the Interstim.
Excuse me?
Interstim. The Interstim is the sacral nerve neuromodulator. Sorry to use this word, but this is what it is. It's a stimulation of a nerve, which is the third sacral nerve. It's not the spinal column. It's one of the nerves that comes off the spinal column. It's in the back. It's in the bottom of your spine, alongside, on one side, either on the other. It's called the sacral foramina. That's what you stimulate. And the treatment is instead of the medication. And what it does is this, you do it for people that have urgency, frequency, and urge incontinence.
Is this a big thing or a little thing here?
It's the stimulator is a pacemaker.
And it's implanted in the body?
It's implanted in the body in the buttock.
It's a computerized device?
It's a computerized device.
And how long does this thing last before
it will last before you have to change the battery approximately about 9 years.
So for 9 years, it gets it controlled?
It gets it controlled. We have people that they have not been able to leave their house. After we have done the implantation, they can go to the movies, leave their house, do shopping, go out.
Is there any problems with it?
Of course there are a lot of problems. I mean, one of the things you have to do is you have to do a testing. The testing is usually done in the office. These people get the voiding diary. A voiding diary is a sheet of paper in which you write down the amount of fluid that you drink in ounces, the time that you drink, the amount of fluid that you urinate every time you urinate, and if you have a strong urge or if you leak, you write down the time this thing happened. This you have to compare it after you do the stimulation in the office, and if you improve 50% of this, you're a candidate for an implantation.
How many of these have we done so far?
Worldwide?
Yeah.
Probably over about 50,000.
And the success rate is?
The success rate is very good. Remember, if you improve over 50%, you're a candidate for this thing. So your success rate is over 50% for the symptoms of the patient. So when you have the urgency and the frequency, you cut down on the urgency and the frequency. With urinary retention, that you have no obstruction, you got to make sure that you don't have any blockage in the outlet of the bladder that is causing this retention. You do your homework first. You do your homework first. It's not that somebody is going to walk in the office and immediately get an Interstim implanted.
Is this a very expensive thing to do?
It is an expensive thing. It's usually covered by most of the insurances. The hospitals usually carry it, and you can do it in any hospital. Most of the insurance cover it.
And you've seen a lot of people get this and have a great change in their life pattern.
It changes their lifestyle altogether. The quality of life gets improved. Urgency and frequency and urge incontinence is not something that's going to kill you.
Has it been on the market more than 9 years?
It's been on the market since 1999. It's been approved by the FDA.
So to replace the battery, is that a big deal?
Replace the battery is simple. It's like a pacemaker on the heart. It's done by the same company that does the pacemaker on the heart.
This is implanted inside the body?
Inside the body, approximately about 1 centimeter underneath the skin.
So like a little incision, change the battery and put a new battery in?
And put a new battery in.
What is medicine leading to next? Unbelievable.